was born in Kosciuszko, of course went to school there. As far as college is concerned, I went to Millsaps and to medical school at University of Mississippi Medical Center and graduated from there. My general surgery residency was at the University of Tennessee in Chattanooga, and I then did a pediatric surgery residency at the University of Washington in Seattle. As far as wound care is concerned, the wound care training was at Ohio State University. I chose surgery from an experience in medical school where on surgery rotation I really found myself wanting to delve deeper into the various parts of surgery and why certain things were done, why the disease process was affected by surgery, and ultimately because at the end of the rotation the chief resident and the attending surgeon said, "You really did a good job of this and we'd like to see you go into surgery." In wound care, unfortunately, we see the patients over and over for extended periods of time. The wounds that we deal with tend to be chronic wounds, and the vast majority are diabetic in origin. Our philosophy of dealing with them is to try to identify what type of wound they have initially and provide them with the best evidence-based medical care that we can provide for them. The challenging part of wound care is limb salvage, or especially for the diabetic who comes and is on the verge of losing a foot or a leg or whatever the case may be. Or they may come to us as a last resort and say, "My doctor said I need to have my leg amputated and I just want to come and have one more opinion before I have that done." And if we're able to salvage a functioning leg for them, that's really a great save for us, and it really makes you feel good. When I come to work each day, I want my patients to leave the care area with the best hope for recovery that we can deliver for them. For some, that's going to be complete recovery, and for others it's going to be an adjustment to the surgical procedures that have been done or the prolonged treatment that they will be required to undergo. But I want them to leave the wound care center knowing that we have done the best that we can for them, that we see them not as a disease process but as a person who comes to the wound center, and we will try our very best to give them the best care they can while also recognizing their human nature side also.